Welcome everyone to this session on mega rapid revision of images in medicine. So yesterday we had a similar session on mega rapid revision of images in surgery. So today we are going to be doing the same for the second major subject that is asked in your exams, that is medicine. So without much further ado, let's begin our class for today. First of all, I hope you guys are able to see me and hear me well. Please leave a thumbs up in the chat box if the streaming is okay. Yes, the streaming seems absolutely fine. So now remember, this class is basically going to be having all the images from medicine that have previously been asked in the exam or that I think are important for your exam point of view and can be asked. All right. So let's begin. The Telegram channel that we have on Unacademy, you can see Let's Crack NEET PG. That is the Telegram channel on which we post the links for all of our free classes. So I highly recommend all of you all to make sure that you join this Telegram channel and get the best benefits and all the free classes. These are our FMG 2021 toppers. The Plus subscription on Unacademy will help you get access to live classes, and also you can learn from India's top educators on the device of your choice at the comfort of your home in a time like this when COVID scenes are so rampant. So you can stay safe and keep studying. The iconic subscription is a partnership between Unacademy and PrepLadder, which will help you get access to the live lectures of Unacademy and the recorded video lectures of PrepLadder along with the question bank of PrepLadder. On this Sunday, on January 23rd, we have a NEET PG combat test, and this combat basically has 5 subjects, your 4 short subjects: dermat, anesthesia, psychiatry, radiology, along with medicine. And here you can win prizes up to 10 lakh rupees, Amazon vouchers, as well as free Unacademy Plus subscription. The special classes that we have are for you guys to try out the platform and see if you like it. So those classes are interactive. You can speak to the educator. You even get a notification reminding you about the class and lecture notes in the form of PDF at the end of the class. We have a highly updated question bank which has 25,000 plus high yield questions. We have raise a hand option in our classes in which you can speak to the educator live during the class and clear your doubts. And these are a few of the batches that are going on right now. So we have the Target NEET PG 2022 MCQ discussion batch, the Focus FMG comprehensive batch, and these are all the free tests that are available for all of you all on the Unacademy platform. And for the 2023 batch, we have an integrated batch between subjects. So you can avail of all of these benefits by a single Plus subscription. And this is the pricing for our Plus and Iconic subscription. On this pricing, you can get an extra 10% off when you use my code Dr.Jhanvi Live. So make sure to buy the Unacademy Plus subscription. I will be starting off with a series in anesthesia in 6 days. So we'll be completing the whole of anesthesia in 6 days, and it is 2 hours every day starting from 19th, that is from tomorrow, and it will get over on 24th. All right, so let's begin with our first session for today. So can anyone identify what is this patient suffering from? In which disease do you see this? Okay, so what is this patient suffering from and which disease do you see this condition in? You can see that he has an arched back over here. He's not lying down like a normal patient in supine position. Yes, very good, Mulai. So this is seen in tetanus poisoning. What is this positioning called as? And it is also seen in one more poisoning, opisthotonus. Very good, Ravi Shankar. Okay, so when he is arching his back like that, this is called as opisthotonus. Also, this is seen in one more poisoning. Everyone is saying tetanus, good Manali, but there is one more poisoning which causes opisthotonus. I'll write the answer over here. It is also seen in strychnine poisoning. Okay. Now, the reason for this opisthotonus is nothing but meningeal irritation. So, any kind of ingestion of poison or infection which causes meningitis can cause opisthotonus. The other thing that they ask about this is what is the opposite of opisthotonus. So suppose the patient is having a completely opposite arch of the back. What is that position called as? This is opisthotonus, correct? The complete opposite of opisthotonus will be emprosthotonus. Emprosthotonus. Okay. And suppose the patient is lying laterally on the side of his chest and he is arching just like this. If this part is arched, that part of the chest is arched, then that is called as pleurosthotonus. Okay. So you need to know all of them. Now causes of opisthotonus and emprosthotonus are all meningeal irritation, all CNS related causes. On the other hand, the cause of pleurosthotonus is nothing but pleuritis. Okay. All right. Now moving on to our next picture. I think a few of you all saw little bit of the picture. So this is a test which is called as hepatojugular reflux. Okay, you have to tell me in which condition do we do this clinical test and what exactly do we do in this clinical test. I'll give you a little bit of an idea. So basically you press on the part of the liver over here in the right hypochondrium. When you place a pressure and then you look at the rise in the JVP, that is called as hepatojugular reflux. You are pressing on the hepatic region and you are looking at the rise in the JVP. So what is the rise that you look for and what is the condition in which you will get this positive? Anyone? Manali saying portal hypertension. Okay. This is more related to cardiac failure. In fact, you have to tell me which side of the heart, when it fails, you will get a positive hepatojugular reflux. This is seen in case of hepatomegaly whenever you have a right heart failure. Okay, right heart failure, or you have right ventricle diastolic dysfunction. Okay, so what do you see in case of hepatojugular reflux? So when you put pressure for 30 seconds on the liver, you will see that the rise in JVP, if it is more than 3 centimeter, that is when you say that the hepatojugular reflux is positive. Okay, so remember this test, it has come before in the exam. They will also ask you clinical questions like this, which you should be able to answer. Okay, so if the rise in JVP is more than 3 centimeter, when you press on the right hypochondrium, that is when you say that there is right heart failure. Okay, all right, moving on to our next question. So what do you see in the feet of these patients and in which condition will you get this sign? In which condition do you see feet like this? Okay. Manali saying edema. So Manali, there is pedal edema, and along with that there is also edema along the shin of the tibia. But what is this edema due to? Is it edema because of venous congestion? Is it edema because of ischemia, because of reduced arterial supply, or is it lymphedema? And give me the causes of it. Okay, so I will tell you that this is nothing but lymphedema. Okay, so how do you identify? There are different types of edema ka different causes, correct? You have edema due to venous congestion, edema due to ischemic arterial ischemia, and you have lymphedema. So lymphedema is very specific. Okay, so in lymphedema, what do you get over here is something called as the hump sign. Hump sign. So you see this part of the foot, this is like a hump. Okay, and then you see the hump of a camel, and then you see there is squaring of the toes. So the toes look like they are squared out. Okay, so this is called as hump sign, and this is called as squaring of toes. Okay, hump sign and squaring of toes. So in what conditions do you see this? So this is characteristic, both of these are characteristic signs of lymphedema. Now there are congenital causes of lymphedema and also there are acquired causes of lymphedema. Okay, so in congenital cause of lymphedema, can you guys give me any one cause? Any one cause of lymphedema in congenital causes? Alright, so you have Milroy's disease, which is a congenital cause in lymphedema, and the second one is acquired, that is filariasis. Alright, okay. Moving on to our next picture. So identify all of these three pictures and tell me in which condition will you see this. Yes. So very good, Naveen. So what you're seeing in picture number 1 over here, you have three pictures over here. You have to identify all three of them. Okay. So in picture number 1, you are seeing that there is a nodule or a metastasis at the umbilicus. Okay. So this is called as Sister Mary Joseph nodule. Can anyone identify the other two nodules for me? And now it will become very easy because you will know what is the associated condition with this. Very good, Naveen. So we are talking about the metastasis of CA stomach from here. Abhi batao. One is in the axilla, number 3, and one is in the left supraclavicular lymph nodes. So any idea what is this? You need to know the exact names of all of them. Okay, so the one that is there in the left supraclavicular lymph node area, okay, that is called as a Furcow's node. Furcow's node, okay, and the sign that you get in this, if there is secondaries or palpable lump in the left supraclavicular area, then that is called as Troisier sign. Troisier sign. Okay, and in the axilla, if you are getting palpable nodules in a patient of CA stomach, then that node is called as Irish node. This is Irish node. Okay, so all these three metastases are associated with CA stomach. You need to remember this. Okay, moving on to the next picture. So this patient is suffering from which disease? Look at his palms and soles and also look at his palpebral conjunctiva and tell me what is the disease that this patient could be suffering from. Okay, anyone, any idea? Alright, so what are you getting over here? You are getting orangish discoloration of the palms and soles. Okay, now the reason I wanted you guys to look at this picture is that 90% of you in the exam will mark this as jaundice. But if you look at his conjunctiva, the conjunctiva is absolutely white. It's absolutely normal. Okay, so there is a condition that is called as carotenemia. Can you tell me in hypervitaminosis of which vitamin will you get carotenemia? Yes, good answer, Mulai. Can you tell me in hypervitaminosis of which condition will you get carotenemia? Yes, so you get carotenemia in case of hypervitaminosis of vitamin A. Okay. So that is when you get orangish discoloration of the palms and soles, but the conjunctiva will be absolutely normal. So this will help you differentiate between this and jaundice. Okay. So for all those of you who have come in late, I'm just quickly showing you the images that we've already done. We've seen carotenemia. We've seen the metastasis of CA stomach to umbilicus, to left supraclavicular lymph node and axilla. We've seen lymphedema. We've seen hepatojugular reflux, and we have seen opisthotonus. Okay, now moving on to our next picture. Identify this sign and tell me in which disease will the sign be positive. This is the easiest one. I think when you start learning medicine in first year, when you first open respiratory system in the books, you will be asked to learn this sign and also check it in patients in the wards. So definitely all of you all should know this answer. Trithovan sign. Okay. Mandar, absolutely correct. This is seen in COPD. This is also seen in chronic smokers basically. What is the name of the sign? नाम याद है या भूल गए आफ्टर फर्स्ट ईयर? Clubbing. Okay, so this is seen in case of clubbing, yes, but the name of the sign that I was looking for is nothing but Shamroth sign. Okay, Shamroth sign. So in Shamroth sign, what happens? If normally you and me keep, my nails are horrible, but you all try to keep your nails opposing to each other. In between the nails, you will see a diamond shaped area like that. Okay, you will see a diamond shaped area. But what happens in case of clubbing, because of the rounding of the nails, that diamond shape area is lost. Okay, so what you can also remember this as is, what people say is, in search of gold they lost the diamond. Okay, so gold is gold flake for the cigarettes, and they say that in search of gold they lost the diamond that is there between the fingers. Okay, so this is Shamroth sign that is seen in case of clubbing. So it will be positive in patients who are chronic smokers or have COPD. Okay, now the only thing that I am going to tell you in this patient is she is suffering from tuberculosis. They take a sample from this ulcer that is formed in her neck, and they find Mycobacterium tuberculosis over there. So what is the disease that she is suffering from? What is the sign and what is the disease that she is suffering from? Cold abscess? No, this is not cold abscess. Any other answers? Okay, so have you guys heard of TB of the lymph nodes? TB of the lymph nodes is usually happens in cervical lymph nodes. And what happens in case of TB of the lymph nodes? The skin that is overlying the lymph node that is affected, that skin will start ulcerating. So this is the lesion that is seen in TB of the lymph nodes. Now can anyone tell me the name of the lesion? Very good, Mandar. So the name of this lesion is nothing but scrofuloderma. Absolutely correct. This is scrofuloderma. Okay. So this is the ulceration of the skin overlying the skin over the lymph nodes. Okay, so this is called as scrofuloderma. Moving on to our next sign. So these are two signs, and I want you guys to identify both the signs individually and then tell me in which patient will I be able to see this sign. Okay guys, today at 3 p.m. on the same YouTube channel, we will be having our ultra rapid revision of surgery through images. And today we'll be doing the remaining part of the small intestine and appendix and large intestine, all of that through images. Okay, so that is at 3 p.m. Chalo, batao, what are the two signs that you can see in this patient? What is sign number 1 and what is sign number 2? Yes, very good. So here what you are able to see on the inner canthus of the eye is, you can see there is some fatty deposition, correct? So that is, this yellowish part is called as nothing but xanthelasma. And in the eye, what are you able to see? No, it is not immune ring of Wesley, but yes, only medicine in this class. But this part you can see is deposition of cholesterol around the iris, and that is called as arcus senilis, correct? Okay, so both arcus senilis and xanthelasma will be seen in a patient who is suffering from what? Okay, so this condition is, this is seen in a patient who is suffering from hyperlipidemias, correct? Hyperlipidemias, you will have deposition of cholesterol all around, so around the iris and also around the inner canthus of the eye. Okay, yes. So now moving on to our next picture. So identify these three pictures. Tell me what is 1, what is 2 and what is 3, and collectively these three pictures give you which condition? Okay, very good, Kirtika. So she is the first one to identify what is the condition that we are seeing in this. Okay, so the condition that we are seeing in this is nothing but infective endocarditis. Now, can you guys tell me what is seen in picture number 1, what is seen in picture number 2, and what is seen in picture number 3? Okay. So 2 is Osler's notes. Yes. So tell me, Osler's notes are painful or they are painless? Very good. Very good, Rita. Very good, Kirtika. So all of them have identified the whole thing. So the first thing that you can see is you can see rod spots in the fundus of the eye. Okay. So these spots that you are able to see, this is nothing but dot hemorrhages, and these are rod spots. Then number 2 that you can see is along the pulp of the fingers, you will find painful lesions. They are painful lesions. Okay. So the painful lesions are called as Osler's nodes. And the third thing that you see is along the palm, you will see painless lesions. So there is no pain over here, no pain, painless lesions, and these are called as Jhanvii lesions. Okay. So just to remember it, which one is painful, which one is painless, you can remember that Jhanvii or Jhanvii will never cause you any pain. Okay. So you have rod spots, you have Osler's nodes, and you have Jhanvii lesions, and all three of them are seen in infective endocarditis. Okay. All right. Moving on to our next picture. So usually they ask this in opthal, sometimes they may ask this in medicine also. I just want you guys to identify the 3 opthal charts that are the most important, and for checking what are they made. So tell me the names of the charts, chart number 1, chart number 2, and chart number 3. And what do they test? Okay, Mandar, which one is Snellen's chart? Chart number 1, 2 or 3? You have to write 1 is what, 2 is what, 3 is what. Okay, everyone is writing Snellen. Okay, good. So the first chart that we see over here is Snellen's chart. What is it used for testing? Is it used for testing color vision, near vision, distant vision? Yeah, Manali, very good. The third one that she saw was the Ishihara chart. Okay, so the Ishihara chart is used for testing color vision. Okay, now you have to tell me in color vision, it tests color blindness of which 2 colors? It tests color blindness of which 2 colors? And the second chart that you can see is for, yeah, so Snellen's chart is used for testing distant vision. What is the name of the second chart? No one has written the name of the second chart if I see. Yeah, no one has given the name of the second chart. These 2 charts. This is Jaeger's chart. Okay, this is Jaeger's chart and it is used for checking near vision. And then you have Ishihara chart that is used for testing color blindness. Now, what are the 2 colors that you test in this? Very good, Manali. So, you test red and green color blindness in this. Okay. Can anyone tell me what is the number seen over here so that we know whether your vision is perfect or not? Acha. Okay, so this is nothing but number is 74. Okay, so the number over here is 74. So this is Ishihara chart used for checking your color vision and it helps in identifying red and green color blindness. Other than that, Snellen's chart and Jaeger's chart. Okay, now this particular test is done in which disease? What is the name of this test? And you will see this test positive in which disease? So what are you trying to do over here? You're trying to do nothing but you're trying to open up the fist that the patient has formed. So when you're trying to open up the fist, you will see that there is a small tuck, 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 tuck movement like this because of the rigidity in the hand. So this has a particular name. This rigidity has a particular name, and this is seen in a neurological disease. So you have to tell me what is the name of this rigidity and in which disease do you see this. कुछ आइडिया आ रहा है या मैं बताऊं? I know I've not put options over here, but that is so that you try to use your brain a little more. Every time we put options, many of you will go with the elimination method and somehow you will get the answer and you will feel that you know everything. But when you don't put options, you actually know how much you have read and how much knowledge you have grasped. Okay, very good, Mandar. So this is nothing but cogwheel rigidity. Cogwheel rigidity. Okay. So, like the wheel of a cog or the wheel of a train, you will see that the fist opens slowly, slowly, slowly along this arc. Okay, along this arc. Okay, so this is seen in which disease? This is seen in Parkinsonism. There is another rigidity that you see in Parkinsonism, and that is called as lead pipe rigidity. Okay, all right, moving on to our next question. So, this is the sign. You have to tell me in which condition will this sign be positive and what is the name of this sign. Okay, so this patient, basically you're putting his leg down straight over here and then you press along the sole of the foot. So when you press along the sole of the foot or you dorsiflex the sole of the foot, you start getting pain in the calf. On dorsiflexion of the sole, you will get pain in the calf. What is the name of this sign? No, this is not clonus. No, this is not Hoover's sign. Mansa, you're right. This is positive in deep vein thrombosis. But can you tell me what is the name of this sign? Not upper motor neuron disease. When you dorsiflex the foot, you will get pain in the calf. This is called as, anyone? Nahi aa raha? Okay, okay. This is called as Homan sign. Okay, this is called as Homan sign. I'll show you a couple of more signs that are positive in DVT, and there are in fact 3-4 signs that you need to know for the exam that are positive in DVT. All right. Okay. Now, this is the other sign that you see in DVT. You have to tell me the name of this. So, when you flex at the level of the knee and squeeze the calf, you will have pain in the calf. So, what is the name of this sign? What are you doing over here? You squeeze the calf and that will give you pain in the calf. What is the name of the sign? Very good, Kirtika. So this is called as Moses sign. This is called as Moses sign. Okay. So this is also positive in DVT. So first thing we get positive in DVT is Homan sign. Then we can also get Moses sign. There are 2 more signs that are positive in DVT. I'll show you ahead. Now, what are these 2 signs? Sign number 1 is different. Sign number 2 is different. And both of them are seen in one condition. So the first sign that you see over here, you are flexing the leg over here onto the abdomen of the patient. So you're trying to bring it to the abdomen. Okay. And the patient will start complaining of pain. The second sign that you see, I'm so sorry. You're not flexing it to the abdomen. What you're doing is you're picking the leg up like this. Okay. So the knee is flexed over here. You try to pick the leg up like this. So the leg will not extend completely. Okay. You will get pain. The second is when you try to lift the head of the patient, automatically his hips and his knees will also flex. So yes, very good, Rita. So the first sign that you're seeing over here is Kernig's sign. First sign is Kernig's sign. And the second sign where how I remember is B for butt. Okay, B for B-U-T-T butt and B for Brudzinski. Okay. So the patient will try to lift the butt also when you lift his neck. So that is for Brudzinski sign. And both of these are positive in meningitis. Barabar? This is Kernig sign and Brudzinski sign. Both of these are positive in meningitis. Very good. Moving on to our next question. So, what is this sign that you see in this patient? And this is seen in which disease? This sign is seen in which disease? Very peculiar sign and very peculiar disease also. No, Mandar, this is not tendinosynovitis. Very good, Ankita. So this is Dupuytren's contracture. Okay. Can you see the contracture in the middle of the hand over here due to fibrosis of the tendon? So this is called as Dupuytren's contracture. And in which condition do you see Dupuytren's contracture? Anyone? Very good, Ankita. So this is seen in case of chronic liver disease. Liver cirrhosis or chronic liver disease. So when you have liver failure, you will be able to see the Dupuytren's contracture. Okay. Alright. So here you have seen meningitis signs. Here we have seen Dupuytren's contracture seen in chronic liver disease. Now this is the next thing that you need to diagnose. So now look at this person over here. You are eliciting a sign in this patient. What are you doing? You make him lie down on all fours just like a dog, and then you place the bell of the stethoscope on the most dependent part of the abdomen. So what are you testing over here? A, and what is the name of this sign? Patient is on all fours and the most dependent part of the abdomen you will be. Very good, Mulai. So this is called as puddle sign. Absolutely correct. So in puddle sign, what are you testing? Pouch of Douglas? No. Welcome to the class, pancake. Looks like you were making pancakes for breakfast, so you got late. Very good, Ankita. So puddle sign is basically to elicit any kind of free fluid in abdomen. Okay. So if you make the patient stay down like this on all fours, and with the stethoscope you listen to the sounds in the abdomen, you will be able to hear a thrill of the fluid. Okay. So what is the minimal amount of fluid that should be present, free fluid that should be present, so that your puddle sign is positive? Any idea? Minimal amount of fluid that should be present? Yes, this is seen in ascites. Okay. So at least 150 ml of free fluid should be present in the abdomen for puddle sign to come positive. Okay. And if what is the best way to diagnose even the most minimal amount of free fluid in the abdomen? So you can do a ultrasound of the abdomen. Okay. You can do an ultrasound of the abdomen in order to identify the most minimal amount of fluid in the abdomen. Okay. So next sign. Identify this sign and tell me one or two conditions. How many ever you all can tell me in which this sign is seen? Okay. So Rita is saying it is Cullen sign. Absolutely correct, Rita. So this is called as Cullen sign. And in which condition do you get Cullen sign? Cullen sign is nothing but if you have ecchymosis around the umbilicus. Okay. So in which condition can you get Cullen sign positive? Pancreatitis, very good. Any other? Be very specific in hemorrhagic pancreatitis. Okay, that is a complication of pancreatitis, not just in normal acute pancreatitis, but in hemorrhagic pancreatitis you will have ecchymosis. And the second one, in females you get that condition. Any idea? Okay, in ruptured ectopic pregnancy, there has to be some rupture, there has to be blood from somewhere coming up. Okay, but in ruptured ectopic pregnancy you can get Cullen sign positive. Okay. Alright, now moving on to similar signs. Just like Cullen sign, you have two similar signs over here. So here you are seeing the first one. And this is ecchymosis around the flanks. You can see over here, there is ecchymosis around the flanks. So what is the name of the sign and in which condition do you get this? Everyone is still stuck on Cullen sign. What is the name of this sign? Ecchymosis around the flanks. Very good, Rita. So this is called as gray Turner's sign. Okay. So in the center, C for center and C for Cullen's. Okay. That's how you can remember. If you have ecchymosis in the center, it is Cullen's sign. And gray Turner's sign is ecchymosis in the flanks. Okay. So you can remember it like when you ask the patient to turn and show his flank, that is where you get the ecchymosis. And what is the cause for gray Turner's sign? Gray Turner's sign is due to retroperitoneal hemorrhage. Retroperitoneal hemorrhage. Okay. Alright. Moving on to our next sign, and tell me the condition in which you will see this sign. So what are you getting over here? When you ask the patient to look forward, you will see that the upper eyelid is completely retracted. So there is retraction of upper eyelid. What is the name of the sign and in which condition do you see it? That is why you are able to see the upper part of the sclera very well. Exophthalmos, okay. What is the name of the sign in which you can see the upper part of the sclera due to retraction of the upper eyelid? नाम बताओ मुझे sign का. That's what they ask in the exam. Everyone knows that this is seen in Graves' disease. Everyone knows that it is related to hyperthyroidism, but everyone, very good Ankita. So this is called as Dalrymple sign. This is called as Dalrymple sign. Okay, now how to remember all the thyroid signs? I will give you a small mnemonic for it. It will be easy for you to remember. So what you can identify in Dalrymple sign is he's looking aake far ke, correct? So remember, when you look at your darling sounds a little bit like Dalrymple. When you look at your darling, you look at her with wide eyes. Okay, you look at your darling like this with wide eyes because you find your darling so beautiful. Okay, so that's how you can remember this is Dalrymple sign. Okay. Now, next one. This sign, first one, and this sign, second one. Thank you, Rita. Okay. Now, what is happening in this sign over here? The first one. So, you are not able to converge your eyes. Okay. You are not able to converge your eyes onto the index finger. So, there is absence of convergence of eyes. So this is seen in which size? What is the name of the sign? Absence of convergence of eyes. Yes, very good Ankita. So this is called as Mobius sign. Okay. Now how do you remember Mobius sign? You can just remember it like Mobius say, you can remember mobility of the eyes is affected. Okay. So the mobility of the eyes is affected, and that's why you're not able to move the eyes and look in the center towards the index finger. Okay. So that is how you remember Mobius sign. And here what is this auntie showing you? The second one is basically when she is looking up, there is no wrinkling of the forehead. Okay. So there is absence of wrinkling of the forehead. So in what condition do you get absence of wrinkling of forehead? Yes, Staphylococcus, we can give her convergence exercise. What is the name of the sign in which when you look up, you don't get wrinkling of the forehead? Very good, Rita. So this is nothing but Geoffroy's sign. Okay, how can you remember this? Geoffroy mein 2 F hai over here. Okay, F say you can remember forehead. Okay. So absence of wrinkling of the forehead. So that is how you can remember all these signs that are present in Graves' disease. Now there are a few more signs that are present in Graves' disease, and I'll write it over here. So there is lid lag sign. What is the name for lid lag sign? That is von Graff's lid lag sign. So you ask the patient to, you move the finger down and ask the patient to look down, so the upper eyelid will lag. Okay. And then you have infrequent blinking. The patient will not blink very often. So that infrequent blinking is called as Stellwag sign. Barabar? So these are all the signs of Graves' disease that you need to remember for your exam. Okay. Alright. Moving on to our next sign. So identify the sign. What is happening over here is you can see this person is putting pressure over the McBurney's point, okay, and while he puts pressure over the McBurney's point, he is getting referred pain to the umbilicus. So can you identify this sign for me, and in which condition do you see it? Obviously, if we're talking about McBurney's point, it has to be related to appendicitis, barabar. So pressure over the McBurney's point. I'm waiting for you all to answer. Batao. Will give you referred pain over umbilicus. Anyone? Any idea? It is seen in appendicitis, barabar. But what is the name of that sign? नहीं पता ठीक है I will tell you the answer. If you guys don't know, you can write in the chat box that you don't know the answer, okay, and we'll not waste our time, we'll go ahead with it. So this is called as Aaron's sign, okay. So appendicitis ke just like DVT had Homan sign, Moses sign, and just like that in appendicitis also we have 3-4 signs that you need to know, okay. So this first sign that you need to know is Aaron's sign. So when you're pressing over the McBurney's point, you will get referred pain over the umbilicus, okay. Moving on to this next test, and tell me in which condition will you use this test. Okay, very good, Kirtika. So this is nothing but the Allen's test. Okay, so this is your Allen's test. When is Allen's test used? Allen's test is used to check the patency of the ulnar artery or the collaterals whenever you are going to use the radial artery. Now, in which condition will you use the radial artery? You can use the radial artery for collecting ABG. You can use it for CABG if you want to take radial artery graft for the coronaries, and when you want to put invasive arterial line. Those are the 3 conditions in which you will do the Allen's test, okay. Now Allen's test, you should need to know what is the modified Allen's test also, because sometimes they ask that in the exam. So in the modified Allen's test, you ask the patient to make a fist, okay, before occluding both the radial and the ulnar arteries. You ask him to make a fist, occlude both the radial and the ulnar arteries, then ask him to open the hand or unclench the fist. So here you will see that the hand is completely blanched. It is white in color because of no blood supply, okay. Now slowly you release your ulnar artery and look for the palm to again gain red color, okay. So that is called as positive modified Allen's test. If the ulnar collateral is working, your palm will become red, and that is called as positive modified Allen's blood test, showing you that there is good collateral flow, okay. So remember, in modified Allen's test, you are using the clenching and unclenching of the palm, okay. All right. Now this is an important sign in dermat that is asked for the exam. So what is the name of this sign, and in which condition do you see it? Now what am I doing over here is I am pressing this blister. So when I press the blister, it spreads to the adjacent skin. The blister spreads to the adjacent normal skin. What is the name of this sign? Rita, this is not Nikolsky sign, but you're very, very close. Okay. So this is actually called as indirect Nikolsky sign. Okay, this is called as indirect Nikolsky sign. This also has another name, and that is Asbo-Hansen sign. Now, can you tell me indirect Nikolsky sign is seen in which condition? Two dermat conditions in which you will see it. This is seen in Stevens-Johnson syndrome and in toxic epidermal necrolysis. Okay. Now, if you put pressure on a blister and you see that in the surrounding skin you have formation of new blister. Okay, this is not spread of the blister, you are getting an altogether new blister formation. Then this is called as your Nikolsky sign. ठीक है, दोनों में difference समझ में आ गया. In indirect Nikolsky sign, you just have spreading of the blister to the adjacent skin. On the other hand, in proper direct Nikolsky sign, you are having formation of a new blister, completely new blister next to the old blister. Okay, so that is called as Nikolsky sign. All right. Okay. Now identify this sign and tell me the condition in which you will see this sign. So what are you doing when you take the back of a pen and you touch it along the angle of the sole of the foot, you will get dorsiflexion of the big toe. So in a normal patient, you are getting flexion of the toes, but in an abnormal patient, you will get fanning of the toes when you do that. So in which condition do you see this sign and what is the name of the sign? This is a normal patient. This is an abnormal patient. Very good, Ankita. So this is Babinski's sign, or you will call it as Babinski's reflex is positive if you have fanning of the toes, and this is seen in upper motor neuron lesion. Barabar? Upper motor neuron lesion. Good. Moving on to our next sign. Okay, so here what are you doing? You have to tell me the name of the sign. What am I doing over here is I apply a BP cuff to the calf of the patient and I inflate the BP cuff 80 mm Hg above the systolic BP. Okay, so imagine the systolic BP that was coming in the lower limb was around 120 and the diastolic was 80. So now I am going to inflate this calf BP up to 200 systolic. Okay, so when I do that, the patient gets pain in the calf. What is the name of this sign and in which condition will you see this sign? No, it's happening in the lower limb, not in the upper limb. I'm talking about the calf. Okay, I'll give you one small hint. Anything that is happening in the calf, na, just remember that it is related to DVT. Okay, so this sign is positive in DVT and it is related to the calf. So the name of this sign is nothing but Lowenberg sign. Lowenberg sign. Okay? Seen in DVT. So we have seen 3 signs in DVT as of now: Homan sign, Moses sign and Lowenberg sign. Clear? Okay, this one is the easiest sign that I could have asked you all. Jaldi batao. Yes, very good, Afsha Khan. So this is nothing but ecchymosis over the mastoid. Okay. So we saw ecchymosis around the umbilicus, that was Cullen sign, around the flanks, that was Gray Turner sign, and when you have ecchymosis around the mastoid, this is called as battle sign. This in fact was recently asked in the NEET PG exam. And when do we get battle sign positive? Anyone? What conditions do we get battle sign positive? Very good, Ankita. So base of skull fracture, not just skull fracture, base of skull fracture, and the second condition that you get it in is middle cranial fossa fracture. Okay, all right, moving on to our next sign. I want you to identify over here what are these spots that you are getting in the sclera and in which condition will you see it. Today at 3 p.m. guys, ultra rapid revision of surgery through images. On the same channel, we will be doing large intestine as well as the remaining part of the small intestine. Very good. Afsha staphylococcus. This is nothing but Bitot spots. Okay, these whitish spots that you seen on the sclera, these are Bitot spots, and this is seen in vitamin A deficiency. Okay, so we saw hypervitaminosis A in the beginning that was causing carotenemia, and now we are seeing the white hot spots that are seen in vitamin A deficiency. Okay, all right, moving on to our next sign. So here what are you getting? You are pressing the patient's abdomen. Okay, when you press the patient's abdomen and when you release it, on releasing the patient will get tenderness. So that is called as rebound tenderness. Okay, now you have to tell me this rebound tenderness is positive in which case? Give me two conditions in which rebound tenderness will be positive, and what is the name of the sign that I'm doing? I push the abdomen in. When I release it, I get pain along the palpating abdomen. So that is called as rebound tenderness. Yes, very good. So this is seen in case of peritonitis. Anything else that you see it in? You also see this in acute appendicitis. Okay. Name of the sign? Everyone knows it as rebound tenderness, but no one knows the name of the sign. Name of the sign is Bloomberg sign. Okay, this is called as Bloomberg sign. Alright, now I do something very similar. Okay, I make the patient sit up, and no, that is Bloomberg sign. Okay, now I make the patient sit up and I put my hand in the just below the subcostal margin. Okay, and then I ask the patient to take a deep breath. When he releases the breath, he will have pain. So what is the name of that sign? I am doing the same sign in sitting position and then in supine position. Both of them have different names and both of them are seen in the same condition. It's seen in the same condition, but I'm just having two different signs because two different scientists found it. One was doing it in the sitting position, one was doing it in the lying down position. So you're holding against the subcostal margin, the patient is holding his breath. When he releases the breath, he gets pain. Very good. Both of them are seen in cholecystitis. You can get a good idea about it because of the fact that he is pressing on the right hypochondrium area. Very good, Mulai. So the first one, in the sitting position, the sign that you do is called as Murphy's sign. And in the supine position, what is it called? Supine position, if you do the same thing, it is called as Moynihan sign. Okay, so this is where they catch in the exam. They will ask you in the sitting position and they will give you one of the options as Moynihan's, or they will ask you in the supine position and they'll give you one of the options as Murphy's. So be very careful about it and mark it correctly. Okay, all right. Now, another sign that you see in appendicitis, I think most of you all will know the name of this sign. So if I palpate on the opposite side, in the left lower quadrant side, I get migratory pain on the right lower quadrant side. So what is the name of this sign? Any idea? It is seen in acute appendicitis. It is migratory pain sign. If I palpate in the lower left side, left lower quadrant, I get pain at the level of the appendicitis on the right lower quadrant side. Very good, Rita. So this is called as Rovsing sign. Okay, this is called as Rovsing sign. Okay. What is, identify this condition and tell me the underlying disease. Very good. So this is seen in portal hypertension, and what are you seeing over here? You are seeing varicose veins along the umbilicus, correct? Varicosities along the umbilicus, or portosystemic anastomosis along the umbilicus. What is this called? Caput medusae. Excellent. Seen in portal hypertension. Okay. All right. Tell me the names of these two signs and tell me the condition in which you will find this positive. So the first one, when I tap on the cheek along the facial nerve distribution, I will get the patient to have a facial twitch. And the second one, when I inflate the BP cuff above the systolic blood pressure, I will get a carpopedal spasm. Okay. Yes, the first one is Schwostek sign and the second one is Trousseau sign. Okay. Now, how to remember which is Schwostek, which is Trousseau? Sometimes you will get confused in the exam which one is Schwostek, which one is Trousseau. So just remember Schwostek mein CH aata hai over here. So CH means cheek ke liye. Okay, so you're tapping on the cheek. So that's how you can remember. And both of these signs are positive in hypocalcemia. Barabar? Okay. Moving on to the next picture. So what do you see in this patient and what condition could be positive in her? This is more of a dermat related question, but if you guys get it, then good. Anything that you can see below her eyes, which is very specific? Can you see these multiple folds below her eyes? What are these folds called? Very good, Aksha. So this is called as Denny Morgan's folds. Okay, the folds below her eyes, they are called as Denny Morgan's folds. And in which condition do we see Denny Morgan's folds? They are seen in atopic dermatitis. Excellent. Another thing that you see in atopic dermatitis is you will have pallor in the perioral space. Okay, so this area will look very pale as compared to the rest of the skin. So that sign, perioral pallor, any idea what is the name of that sign? That is also called as headlight sign. Okay. Alright. Moving on to our next picture now. So these are reddish spots that are present along the palate of the patient. So rose colored spots on palate. Any idea about it? What are these spots called and in which condition do you find them positive? And the second one that I want you guys to identify over here is you have white colored spots over here along the buccal mucosa. Okay. So this is white spots along buccal mucosa. Erythroplakia, no? Yeah, very good, Afsha. So the first one, the rose-colored spots on the palate are seen in rubella, and these rose-colored spots are called as Forchheimer spots. Okay, Forchheimer spots. And when you see white-colored spots, leukoplakia will be more of a ulcer-looking continuous lesion. Here you're seeing whitish spots on the mucosa, okay, and specifically in the mucosa in front of the second molar if they ask you. So this is called as Koplik spots. And in which condition do we see Koplik spots? We see this in measles. Okay, so two conditions that we see in children, the Forchheimer spots in rubella and the Koplik spots in measles. Okay, now in this patient, I want you to notice the ecchymosis over the area of the inguinal ligament. So what is the name of this sign and in which condition do I get it positive? So we saw Gray Turner's sign in which we had ecchymosis over the flanks. We saw Battle sign, we had ecchymosis over the mastoid. Cullen sign, we had ecchymosis around the umbilicus. So this is the next sign. You see ecchymosis around inguinal ligament or over the inguinal ligament. What is the name of the sign? Upper molar, Afsha. Second upper molar. Yeah, this sign is called as Fox sign. Okay. Alright, moving on to the next one. Identify this sign. Tell me the condition in which this sign is positive. Very good. So this is called as Gover's sign. Okay. So the child will basically, while he is trying to get up, he has to use his hands on the floor and then onto the knees, and then he has to try and get up from the floor. Okay, so he has to get up on all fours. That's what we say. And this is positive in which condition? Gover sign, not Bower, Gover sign, G. This is positive in Duchenne muscular dystrophy. He's using his hands as support to get up from the ground. Okay, next sign. For those of you who are confused which one is the abnormal half, I'll give you a clue. This is the abnormal half, and I want you guys to focus on the pupil. What is the name of this condition? When you have a unilateral dilated pupil, and in which condition will you see this? Okay, so this is called as Hutchinson pupil. Okay, one side dilated pupil, this is called as Hutchinson pupil, and this is seen whenever you have irritation of the third cranial nerve. Okay, there could be a tumor, there could be a hemorrhage in the brain that is causing irritation of third cranial nerve, and that will lead to dilatation of the pupil. Okay, but one-sided only. So this is called as Hutchinson pupil. All right. That is not seen in Hutchinson pupil is not seen in syphilis, Afsha. You see something else in syphilis that is related to the name Hutchinson. So I have given you the picture of that over here. ये बताओ क्या है? You have notched upper molars. Sorry, notch incisors, not upper molars. These are your incisors and they are notched. What is the name of this? Very good. This is called as Hutchinson teeth. And in which condition do you see this? Notched incisors, Hutchinson teeth, seen in case of congenital syphilis. Barabar? Tell me the 4 signs that you see in congenital syphilis. Anyone, tell me the 4 signs that you see in congenital syphilis. What are the molar causes called as? What happens in the tibia? And what happens in the eye? What happens to the nose? What happens to the angle of the mouth? Okay, very good. I've got at least one answer. No, 2 answers from Afsha. Very good. You get sensory neural hearing loss in the ear. In the eye, what I get is interstitial keratitis. What do I get in the tibia? Or the nose or the molars? Yeah, all these are signs of congenital syphilis. That's why I'm writing it over here. Hutchinson incisor we have already seen in the picture above. What about the tibia, guys? Okay, you have anterior bowing of the tibia. So that tibia which has bowed is called as saber tibia. Okay, anterior bowing of the tibia. Mulberry molars, very good. And nose ko kya ho jata hai? Nose becomes, the bridge of the nose falls down. Okay, so that bridge of the nose falling down is called as saddle nose, flat nose or saddle nose. And what do you get in case of angle of the mouth? You get a particular lesion at the angle of the mouth, and that is called as regards. Okay, you get lateral lesions at the angle of the mouth called regards. Okay. So this is a patient who's suffering from herpes zoster ophthalmicus, and you're seeing a ulcer along the nose over here. So he has herpes zoster ophthalmicus. You can see the picture of it over here, and he has some ulcer along the nose also along with it. So what is the sign called as? And this is due to involvement of which nerve? Clutton's joints. Okay, you all are still talking about syphilis. Tell me the name of this sign. In a patient of herpes zoster ophthalmicus, if you also have a lesion along the side of the nose, this is called as Hutchinson's sign. Okay, this is Hutchinson's sign. So I have actually uh, clustered everything about Hutchinson in one place and given it to you all. Now this is because of the involvement of the nasociliary nerve. That is why you are having the herpes that is spreading from the part that is applying the forehead to the nose. Okay, because of the involvement of the nasociliary nerve. So these are all three things about Hutchinson that you need to know: the Hutchinson pupil, the Hutchinson teeth, and Hutchinson sign. Okay, all right. And the last image for today: identify condition number 1 and identify condition number 2. Afsha, very good. The first one is nothing but Kayser-Fleischer ring. The first one that you see over here, this is Kayser-Fleischer ring. When do you get Kayser-Fleischer ring? You get due to deposition of copper in case of Wilson's disease. Barabar? So what is deposited over here? You have copper deposition in the Descemet's membrane. And the second one that you can see over here, these brownish nodules that are present on the iris, these are called as leash nodules. And when do you see these leash nodules? You see these leash nodules in neurofibromatosis 1. Other things seen in neurofibromatosis, you will see cafe au lait spots, you will see, okay. So these are all the things that are asked in medicine as common signs and symptoms that you should be able to identify in the exam. I'm just quickly going to go through all the pictures that we have seen till now. So we have Kayser-Fleischer ring, leash nodules, we have Hutchinson's sign, Hutchinson's teeth, Hutchinson pupil, Gower sign. Here we have Fox's sign, ecchymosis over the inguinal ligament, for Scheimer spots, rose-colored spots on the palate. Then the white spots in front of the second molar are your Koplik spots seen in measles. Denny Morgan's folds in atrophic dermatitis. Hypocalcemia signs, Schwastek and Trousseau sign. Then caput medusae seen in portal hypertension. Rovsing's sign in acute appendicitis. Murphy's and Moynihan's sign in cholecystitis. Bloomberg sign of rebound tenderness seen in peritonitis, acute pancreatitis, acute appendicitis. Bitot spot seen in vitamin A deficiency. Ecchymosis over the mastoid battle sign. Then this is your Lowenberg sign seen in DVT. Babinski's reflex seen in upper motor neuron lesion. Nikolsky sign, and you have indirect Nikolsky sign. You should be able to differentiate between both of them well. This is your modified Allen's test and your original Allen's test. Then your Aaron's sign seen in appendicitis. Then your sign seen in Graves' disease. Mobius sign, Geoffroy's sign, Dalrymple sign, Von Graff and Stelzach sign. Then you have Gray-Turner's sign, Cullen's sign, Puddle's sign, Dupuytren's contracture, Koenig sign, Brudzinski's sign, Moses sign seen in DVT, Homan sign seen in DVT, Cogwheel rigidity seen in Parkinsonism. Your Ishihara chart, Snellen's chart, Jaeger's chart, Roth spot, Osler nodes, Jhanvii lesions seen in infective endocarditis, Arcus senilis and xanthelasma seen in hyperlipidemia, Scrofulloderma seen in TB of the lymph nodes, Shamroth sign seen in chronic smokers, Carotenemia seen in hypervitaminosis A, Sister Mary Joseph nodule, Furcow's nodes or Truser sign, and Irish nodes seen in case of CA stomach. And you have lymphedema over here, and hepatojugular reflux and opisthotonus. Okay, so those are all the important signs that you need to know on part of medicine for your exam. I hope that the session was useful to you guys. If you like this session, please don't forget to leave a thumbs up at the end of the session. There is a thumbs up mark over there. Subscribe to our channel. I'm taking such sessions every single day, either on the Unacademy app or on YouTube. So I highly recommend all of you all to join the channel so that you'll get all of this for free. Okay. So yes, I will end the class with my beautiful smile. Thank you so much. And remember, today at 3 p.m. guys, we have a class in which we will be discussing ultra rapid revision of small intestine and large intestine. So we have been doing that ultra rapid revision of surgery since the past I think almost 6 days. We finished esophagus, we finished stomach, we finished part of small intestine, swellings in surgery, as well as head, face and neck. They're all available absolutely free on this channel. Make sure you use all of them for your revision for the exam. So I shall see you next time at 3 p.m. guys. Till then, take care. Follow the Telegram channel where I will post the links for all these classes. This is the Telegram channel. Let's crack NEET PG. Okay.